Well, thank you. Supervisor Chavez and I are delighted to be here. The person who has actually given me the longest introduction was Chris Wilder. And if you've ever been introduced by Chris Wilder, it really goes on for about 10 minutes. And he ignores the time card as well. But Dolores, I think you've almost beat him as far as length of time. But it's really wonderful to be here. Thanks for all sort of coming out. This is really a very important anniversary, 7 years, and we've just had such great success with the ACA. And as we all know, for the last 7 years, the Republicans have wanted to repeal it, even though they never told us what they wanted to replace it with. And the reason why they didn't, as we have found out, is that it would be such a disaster, and so many people who have gotten great medical care because of the ACA would lose it. And I think they knew how bad it was going to be, how much it was going to hurt any of their political chances if they actually were able to get it passed. And lo and behold, with the Republican Congress and President Trump, we've found out really how terrible it would be. In Santa Clara County, the ACA has just done remarkable things. I almost want to say that of all of the counties in California and probably in the United States, we've had the biggest impact with ACA here than anywhere else. And just to give you some of the statistics, although you've heard some already, 136,000 people have gained coverage through the Medi-Cal expansion. Can you imagine if they weren't able to have that coverage that they do now? Another 51,000 have subsidized coverage through Covered California. We have a 53% drop in overall uninsured in Santa Clara County. 91% drop in the number of uninsured patients seen at VMC since December 2013. We've helped stabilize VMC finances. As a public hospital, VMC will always need some support from the county general fund, but ACA has allowed VMC to rely less on the general fund. In fact, last year we were able to return $75 million back to the county. And this financial improvement allowed us to invest in expanding access and improving care. We've increased our primary care capacity by 66%. Our wait times for primary care appointments have dropped from 53 days to less than 48 hours. And wait times at VMC, ER, pharmacy, and phone system have been significantly reduced. And it's been a long 7 years in the making, but really through the cooperation of everybody at VMC and our clinics and the community partners, we've been able to have this type of success and been able to give people coverage that they never had before. And all of this is going to be at risk if the Republican plan is able to be passed. We're looking at 14 million people would lose their coverage. By 2020, that number would rise to 21 million. And if Medicaid expansion alone goes away, Santa Clara County is at risk of losing more than $200 million in revenue. And the bill also includes devastating cuts to Planned Parenthood, reducing access to women's health care. All told, the bill pulls more than $1 trillion out of the healthcare industry over the next 10 years, all while doing nothing to control healthcare costs over that period of time. And Supervisor Chavez and I are really just here to pledge that we are going to do everything that we can to fight the Republican plan. And should some disaster happen and is actually approved, the county is going to do whatever it can to provide as much medical care to people who are going to lose their coverage. And Supervisor Chavez, with all of her work, I know will make sure that particularly Planned Parenthood, should they lose federal funds, that the county will step in as much as we can to provide the funds that they lose. We are committed here in the county to healthcare, quality healthcare, and we've been working with President Obama for the last 7-8 years, and we'll continue to fight for medical coverage here in Santa Clara County. Supervisor Chavez.